Papua New Guinea is facing a double health crisis as the pandemic interferes with tuberculosis treatment programs and COVID-19 cases soar. The government is planning to start a national vaccine rollout in May, but the response to the coronavirus has pulled resources from other critical health programs. For more, I'm joined by Tracy Yuen, who's the health advisor at Child Fund Australia. So much for your time. We've been hearing a lot over the last few weeks about the COVID-19 outbreak in Papua New Guinea. Where's the situation at now?
So as of today, I believe PNG has had just over 7,500 confirmed cases and 68 deaths. And we're seeing an average of around 200 to 300 cases a day, and this is rising. So of course we know this is a vast underestimate as there is community transmission across the country and very low testing rates, which means we're only seeing a tip of the iceberg. A lot of cases testing positive also haven't been known contacts of COVID cases. So again, that indicates that there's a lot more community transmission than the numbers are showing, because we're just missing a lot of links in that transmission.
Yeah, the underreporting and the low testing rates are a real problem there. How much of an issue is tuberculosis in Papua New Guinea?
So unfortunately, Papua New Guinea is one of the few countries in the world with high rate of TB, drug-resistant TB and TB HIV. They also have a very high portion of their cases in children, much more than the global average. So this was already a public health emergency prior to COVID-19. And in fact, globally, TB, tuberculosis, was the leading cause of death from a single infectious agent prior to COVID. But of course, now that's been eclipsed by COVID. So
having these two conditions circulating in the community must really be stretching health resources.
Yeah, with the COVID-19 pandemic, the already stretched health system has just become even more stretched to breaking point. A lot of attention and resources have gone into dealing with the COVID pandemic, and unfortunately, this has meant that a lot of other really important health issues like TB and other maternal and child health issues have just been left behind. So since the pandemic, we've heard a number of really unfortunate cases. We've heard of some of our rural health facilities halting TB services because staff have feared being in contact with COVID cases, because TB patients have similar symptoms to COVID as well, including coughing and fever. We've seen interruptions to medical supplies and testing because human resources have really become stretched and logistic lines are getting clogged up. Simple things that medical staff in Australia would take for granted are in short supply over there.
Yeah, I heard one doctor describe the hospital system as in a perpetual state of disaster. Are all the hospitals full?
So the hospitals have been converting a lot of their regular wards to COVID patient wards. And unfortunately, there are a number of hospitals around the country that have closed or vastly reduced their services because of the upsurge in COVID. Where we work in our rural areas, a lot of the rural health facilities have been closed due to shortages of resources, of funding, of staffing. So that's the main concern for us at the moment.
Australia has sent 8,000 AstraZeneca vaccine doses to Papua New Guinea. Are we doing enough to help?
I think Australia is being very generous and they've really offered a lot of assistance, but of course the PNG system is just needing as much help as it can get, and whatever we can do to support it will definitely be appreciated and be put to good use. The needs are just so vast at the moment that 8,000 vaccines is a great start and it is very generous, but then there's all of the other health workers in the provinces that haven't been vaccinated, and then of course all the general public that need to be vaccinated as well.
So how desperately needed then are those 1 million doses for India that have been promised to PNG under the UN's COVAX scheme?
Yeah, so they already are hoping to get their first instalments in April, which I believe is just over 100,000 doses. So that will be put to immediate use. I think also because of limits in the infrastructure in the country and the coordination, it will take time to do that rollout as well. So it's no use sending a really huge shipment of vaccines all at once. But they do need to make sure that they have vaccines secured for the population as the rollout continues.
Okay, Tracy Yuen, thank you so much for your time tonight.
Thank you.
Brazil has set